This is a collaborative work that's been done between the University of Ottawa, Alberta Heart Institute, and UCLA. The PI of the study is Rob DeKemp, and it's really his work that led to being recognized with Abstract of the Year. The work is based on a cardiac PET perfusion tracer called Flurpiridaz that was approved by the US FDA in September 2024. And there's a lot of excitement with this tracer because it has a lot of salient properties that leads to it being labeled by some as like an ideal perfusion tracer. It has a half-life of nearly 2 hours. So what that means is that for the first time, we have the possibility in cardiac imaging with a PET probe to do routine exercise stress testing. So what that does is that it opens a whole new avenue of possibilities in terms of physiological assessment of coronary artery disease. A group led by Dr. DeKemp wanted to seek is whether you could have a myocardial flow reserve estimate during exercise stress. And that's really the foundation for all the study that was done and the work that led to Abstract of the Year. It's great for us to have, as imagers, more probes that we can offer our patients. What this does now is that you have the possibility, particularly for lower volume centers who couldn't, let's say, don't have the critical mass to do routine cardiac PET imaging, now you can offer it to your patients. So we think that what's going to happen is that independent of the probe, the volume of cardiac PET imaging nationally will grow because it's an excellent test, not just for coronary artery disease assessment, but also for microvascular coronary disease assessment. And that's something that's very important with the growing epidemic that we have, both in the United States and really globally, worldwide, of obesity, diabetes, etc., which leads to coronary microvascular dysfunction. So basically, you can get very precise assessment of not just flow at the global territory level, but also flow at the segmental, or even some are suggesting now at the subsegmental level. And what that does is that it allows us to have a more granular assessment of what is going on in the vasculature, both the large coronary arteries as well as the smaller microvasculature.